So the presentation that I've done is relating to the use of neoadjuvant chemotherapy in advanced ovarian cancer. So neoadjuvant chemotherapy, two big trials, one of which I ran called CHORUS, and a NEORTC trial, which is a European trial run by Ignace Fargotti, are the two largest trials that have been reported on giving chemotherapy as an alternative to primary surgery in advanced ovarian cancer. The question that was posed, what I was asked to talk about, is who should have that kind of therapy. Both trials showed that you can use it, the chemotherapy first or the surgery first. The outcomes are the very, very same. But there has been quite a marked increase in the use of neoadjuvant chemotherapy. It's averaging at about, if you look at the figures from the UK, the bits you can get from the United States and Denmark, about a quarter of the patients now are having this thing called neoadjuvant chemotherapy, which is a 4- to 5-fold increase in the last 10 years or so of its use. Who should have that and who's preferable? We brought the European EORTC study and CHORUS together. This was all pre-planned many years ago. And what we found was that in women with stage 4 disease, their overall survival was improved if given neoadjuvant chemotherapy. Now, whilst that may well not be for every single stage 4 patients, the evidence is there as you should be thinking about neoadjuvant chemotherapy for those patients. The other cohort of patients that neoadjuvant chemotherapy can be preferable is in those who have got a poor performance status. And in that type of a situation, if you measure the patient's quality of life, if they respond to treatment, you find their quality of life improves, their performance improves, and then it becomes safer to operate on them. So I think they're the two main cohorts of patients I've suggested that they should be viewed and given consideration of neoadjuvant chemotherapy, stressing that we are talking about patients with advanced disease, usually a bit elderly, usually the performance status isn't very good, and specifically it relates to high-grade serous ovarian cancer. This is not for every advanced ovarian cancer, and that's quite important to stress, as some of the advanced cases are different tumour types, and some of those different tumour types you should make a very major surgical effort to get all the disease out. So I specifically want to stress that the studies, both of them, really incorporate just high-grade serous ovarian cancer patients. So that again is a shift. We only published about the outcomes of the stage 4 patients in Lancet Oncology. It just came out in December of last year. So that's the first time we've proven or shown as best we can that neoadjuvant chemotherapy is a preferable therapy compared with surgery, as I say, in those stage 4 patients alone.